So welcome again to our Mother's Health podcast, where we amplify the real stories shaping global maternal health. Today, we are speaking with a woman from Malawi and now living in the United Kingdom, navigating pregnancies between African cultural expectation and the British healthcare system. But this story doesn't sit in isolation because in the UK, Black women are slightly more likely to die during pregnancy and childbirth compared to other races and to other white demographic women. So today we explore what happens when culture, migration, race, and maternal health intersect. So let's begin. And we'll start by introducing our guest. Welcome to the podcast, Jo. Can you introduce yourself?
So I'm Joan Gunde. I am a lecturer at Aden University. I'm a mother of two, an 11-year-old and an 8-year-old. Before I had my 11-year-old, I had another pregnancy, which I lost at about 21 and a half weeks. Yeah. Yes. I don't know, did you want anything else about me?
Yeah, I think that should do.
Okay, thank you.
Yeah, I also to mention, Jo is also a very dear colleague of mine, and I've known her for many years. It's now more than 5 years, isn't it? Yeah, yes. Jo, more than 5 years. So thank you so much for agreeing to join the podcast and just for coming to share your story, because many women are going to learn from our experiences and from the confidence with which we share our story and the lessons that we learn through our journey as well. Yeah. So I'll start by asking you the first question. What does motherhood mean in the Malawian culture?
In Malawian culture, motherhood is unexpected outcome of a woman, a growing woman. I think for me, growing up, all I heard mostly was, how are you going to do it when you're in your own home as a wife, as a mother? So everything we do growing up is almost shaping us women to grow up to become a mother, regardless what you want to do, whether you want to become a nun or not. As you grow up, those are the things that you kind of heard being told. Can you, how are you cleaning the house? How are you going to do that? How did you wash these clothes? They're not clean. Would you do this for your children? That kind of thing. So motherhood is really it's identity. You know that once you it's like, okay, I've been expecting this all my life. Once you get married, that's what you're expected to have the child. If it's not coming early, it's another issue. What's happening? Where's the children? What are you guys doing? So there's a lot. It's a huge expectation, I think, from the community, when I talk about community, I'm talking about everyone, because back home, especially in Malawi, we have this thing of I'm raised as a Catholic, so we have these groups that we meet, in our own areas outside the church that become our community. They are so much interested in all the children in that community. So whether you're on the road walking, you're doing silly things, just know that you're done, because the story has already arrived at home before you even get home. So it's like every step of your life, from your relatives, the extended families, and the people that just know you from being part of the church community. Everybody is looking forward to you getting married and having those children. And once you have that children, it's like, yes, everybody is now welcoming you as a mother. It's a huge expectation, I think, of us. Yeah.
It's interesting as you say that, because I'm Nigerian and I can relate with what you're saying. So I think it's something in our community as Black women. We are expected to do so much. Everyone expects you to, get married, have children, and be able to do them, have those instincts to do what you should do as a woman. And we are prepared from an early stage to handle these responsibilities.
Yes.
Yeah. So we are quite similar, very, very similar. So our podcast today will resonate with all African women,
Yeah.
Black women in the UK, basically, especially those
Yeah.
of us that have migrated from our African culture and also here in the UK. We're expected to be strong as African women. And when
Oh,
we come to
yes.
the UK, there's also the perception that we are also strong. We can
Yes.
handle things. So even in the healthcare system, we are
Yeah.
also expected to be strong as African
Yes.
women.
Yeah. Yeah.
But in many Malawians' home, a woman is expected to endure, like Joe has said, to be strong, to respect authority, not to
Yeah.
complain.
Yeah.
But what happens when the cultural silence enters a Western medical system? So this
Yeah.
takes me straight to the next discussion point. Entering into the UK system
Yeah.
is not easy. From the statistics and the maternal reviews, it shows, especially one particular paper from the British Journal of Midwifery on maternal health inequalities, focusing on Black pregnant women. The statistics shows that Black women are almost 3 times more likely to die during pregnancy or up to 6 weeks after birth compared to white women. And this is in several studies. Black women are also likely to experience morbidity such as hypertensive disorder in pregnancy and in preeclampsia.
Yeah.
And the reason for all of these statistics is directly related to socioeconomic factors. So our age, our income, our health, our education, the environment that we live in. And
Yeah.
this, we are basically the minority group that needs to be focused on to improve maternal care outcomes in the UK. So this is
Yeah.
about the system. It's not just about biology. It's not about bias. It's about listening or not listening. So how did you feel, Joe, during your pregnancy in the UK? How did you feel during your appointments? Did you feel your pain was taken seriously? Do you think you were heard by the healthcare practitioners?
Just before I answer that question, I wanted to just point out something that you mentioned that I forgot to mention about respect. Respect means a whole lot different in Malawi culture, and I know a lot of African cultures, and even some Asian ones, to what it is here. I actually also came across some European people have the same thing about eye contact. Yeah. That anybody who is in authority, we are not to look them in their eyes. And we can overcome that a little bit. Maybe over the years, I think I have overcome it in this country because I've learned, and I learned it the hard way. A story for another day. Almost got fired at work because of not looking at somebody.
Oh, wow.
But it's that can make a big difference if you've got that kind of belief, and you're you want to be heard, you want to be supported in a healthcare service, and you're not able to look into somebody's eyes, and that can be a bit of a problem. So I wanted to just bring that in.
Yeah, lack of confidence, really.
Yes,
Yeah.
it almost looks like that because that's how we've been brought. Like you can't look
Yeah.
at, and especially if they're men, that's another thing. In my
Yeah, I
country,
think
it's like,
it's
yeah,
also the power distance in our
yes,
culture. We are taught to respect authority.
yes,
Yeah, and sometimes authority is also with the male-female relationship. Okay,
yes,
as well.
yeah,
The men are considered the head of the home. They are the head
yeah,
of the home, and you're
yeah,
expected to not, disrespect men,
yeah,
and it carries on when you go out as well in
yeah,
the society. Even
yeah,
the government, you shouldn't challenge elders, you shouldn't challenge the
yeah,
government and things like that,
yeah,
or people that are ahead of
yeah.
you. Yeah.
And that can have a big impact in what question you're asking me in terms of, did you feel hurt? Did you feel, the presence of the healthcare people? If you're a person that is not able to do that, then that's going to affect. But I think with me, I will reflect on my first pregnancy. I Up from the beginning, it almost seems okay. Just the normal routine. going to the midwife, and then attending the antenatal sessions at the hospital. With no expectations in terms of anything could go wrong. I don't think anybody thinks like that unless you've been told to be careful. But if you don't have any experience in terms of having a bad pregnancy, you just carry on as normal. So to me, I almost felt like things were going okay with my first pregnancy until something happened. I lost the waters at 21 weeks. And I didn't know that's what it was, because I woke up and went to the toilet. I think it was around 4 a.m. And I had a wee, and then I came back. And as soon as I laid down on the bed, I thought, oh, I didn't finish weeing. Some more wee came out. That was my childish mind talking to me. And I'm thinking, oh my God. So I got up and go to the toilet to, kind of, why did I do that? But it was quite a lot of, and it didn't feel like actually the way it came out. And then I was like, okay, let me just lay down. But then I started feeling like the water kept coming, so it didn't stop. So it was coming in out slowly. And then around 6, I was like, no, I'm not. Actually, not 6, I think 5. I was like, no, I'm going to the hospital. And I took a taxi and went to the hospital. And I did not feel, that moment is the moment that I didn't feel, heard at all. They used a very small scanner with a screen as small size as a phone.
Yeah.
To monitor the baby. And I know they've got no more monitors. They've got no more, they could have done a normal scan. But they came with this tiny thing, almost like a toy, and just scanned me while I was sitting down. I was not even laying down. I was just sitting on a chair, and this doctor scanned, and they said, "Oh yeah, listen, see, baby's heart is moving. We can hear the baby. Just go back home. Everything is fine." And I'm like, no, I don't feel fine. And I don't think I'm fine. I'm not feeling fine at all. And but anyway, I had to trust what they said. But I left feeling like I should not be going home. So I went home and proceeded to work. And I was having the miscarriage. I was losing the baby. So I went to work, and I remember it was the World Cup. And got excited at work with everyone, rejoicing for England, etc. And then I'm still losing the waters. I had to wear a pad that day. And I'm thinking, I don't know whether this is normal. So I left work and went back straight to the hospital. So from the hospital in the morning, I went straight to work. And then from the work, I finished at 3, I went straight back to the hospital. And I say to them, I don't think my baby is fine. And somebody just filled my belly, and they said, no, just go home. Everything is fine. I said, okay. So I went back home. Now, I slept, but I did not sleep very well. And then I started feeling the heartbeat down there of the baby, and I'm like, no, this is not normal. I shouldn't be feeling a heartbeat there. I shouldn't be feeling anything, and I'm feeling this something. So again, I leave in the morning. I think around 9. I go back to the hospital. Now this is like almost
the
3
next
days
day
now. Yeah, I go back, and then I'm told, just wait. We know you're here. We'll just wait. And I can't sit down. I could not sit down because there was something there. I couldn't.
And there was no urgency by these people.
And I'm feeling contractions. But this is where the community comes in for Malawi. You mentioned in the first segment that, if you're pregnant, if I was to go to the hospital in that situation, if I was home, I wasn't going to go by myself. I was going to have either my mom or someone, a woman in our family to come with me, and they would have known what was going on with me. At that point, I didn't know, but I started feeling contractions, and I felt, why am I feeling something over every few minutes? Like,
Oh, wow.
yeah. And I'm like, what's going on? So I couldn't sit. I was just pacing up and down, pacing up and down. And I kept asking, please, can I see someone? I'm feeling something is coming. Something is coming. Oh, you can't be having a baby. You're only 21 weeks. I'm like, yes, I know, but I'm not, I'm not okay. And unfortunately, eventually they see me 4 hours later, Vivian, 4 hours
Wow.
later. And the doctor that saw me was a locum doctor that was not even from England. Actually, the doctors that saw me the 2 days before were all locum doctors. None of them were based British England doctors. And the doctor says, "Oh, puts the pendulum thing." I'm like, I don't think you need to put anything in. I'm sure as soon as you open my legs, you can see. And they goes, "Yeah, we're sorry that you're losing the baby. We're gonna give you a bed, and we're just gonna wait for nature to take its course, and then yeah." So yeah, call somebody. So I then, by that time, I had already called my husband. He was already on the way, and I called him. I said, they've given me a bed, and yeah, we're losing the baby. Yeah, and that's how I lost my first pregnancy. So given the side bed and sitting in there, well, laying down in there, someone checking on me like casually, but they just gave me that sick ball and said, if you feel like an urge to go and wee, can you put this in the toilet? Without explaining to me why I should put that in there. And I put it in there, and as soon as I pushed wee, obviously the baby came out and it dropped in the sick ball. And obviously I rang the bell because I couldn't then walk, because obviously the umbilical cord is there, and somebody had to come. Yeah, it was so traumatic. I felt like I should have had someone, and I should have had more care. Things should have been explained to me properly, what was to be expected. None of that was done. None of that was done. And as soon as it happened, then the care started showing up. Yeah, because then somebody, I think one of the pastoral care people came and spoke to me. As soon as that person came, I'm not sure what they said to them, but then everybody kind of started fussing around me. And I'm like, don't you think this is a bit too late? I needed this care 4 hours ago, actually 2-3 days ago. This is when I needed this care, not now when things have gone wrong. And the temerity of the NHS to give me a complaint form. If you can make a complaint and sue the hospital if you want. And I'm like, I don't think that is gonna do anything. It's not gonna bring back my baby, is it? And unfortunately, yes, we lost the baby boy because it was over 20 weeks. It was a boy. I had actually just found out a week before that I was having a boy. So yeah, that to me. I did not feel heard at all for 3 whole days by 3 different doctors, and all different ethnicities. I think one of them was British, although was like on locum kind of contract. But yeah, I don't think they had they had the care that they should have been providing. I don't know whether the first time I went in, whether because it was almost finishing time of their shift, because I got there around 6. So I don't know whether they were tired and they couldn't, I don't want to make excuses for them, but I just felt that there was no one who really cared in terms of what is really happening. I think I should have had the normal scan. I actually had I kept the pad that was holding the water in a plastic bag, and it was heavy. And I said, "Do you want to assess how much water I've lost?" No, it's fine. I'm like, but I lost quite a lot on the bed, and walking here, and I'm still losing, and you're saying everything is fine. I don't know whether they knew I was losing the baby and they didn't want to tell me, and then just to wait for the nature to to take its course. But either way, I think I should have been told, like, yeah, we're sorry, you're gonna lose the baby. We're just gonna ask you to wait at home until it. I don't know, maybe if that's what they should have done. But I felt that there was no care whatsoever with my first pregnancy. What happened after that is it's five-star care of pregnancy that I cannot
Yeah.
even complain about. But I had to endure a loss to get a 5-star treatment at the hospital. And I know there was other pregnant people in the same unit that I was in when I was having 5-star, and I could see that they were not being cared for. But because I had endured something in the past, and then the second pregnancy then was, I was being cared for by the head of the consultants. The big boss was my consultant. So everybody knew that's Mr. K's patient. That's Mr. K's patient. So I was almost treated like an egg, which I felt good being treated like that. However, I felt that it was not fair that it had to come because of a loss.
Yeah. I'm dumbfounded just listening to that story. I'm short of words. And I'm sorry that you went through that experience. And for you to even retell that story, I can tell how difficult it is for you, even reflecting back. But this is what is happening to many women today, especially Black women.
Yes.
A lot of times our pain is being dismissed. We are being undermined when we speak up. For reasons I don't understand why it should be.
Yeah.
And like you said also earlier, sometimes we also do not enforce, okay?
Yeah.
Because I know there are other cultures that will just be shouting, okay?
Yeah.
And just say, if you don't do this, I'm holding you by the neck. So this is a wake-up call for people like us from minority background. If you are sure your body is telling you something, because the signs were all there, and these people will not. And even with you, I applaud you. You were saying you went back to the hospital. You went back and you went back. So it was not anything that was your fault. It was not that you didn't speak up like other people. Some people would just be quiet. You spoke up. You went back and you felt something was not right. You went back and you asked for that help. And these people undermined, dismissed your pain.
Yeah.
Even you were teaching them, can you check this? This is not right. And everybody, overlooked your pains and everything, and just carried on as if nothing is happening. And this is the reason why many women are dying. Black women are dying, because they are being undermined and overlooked when they have pain.
Yes.
So sorry to hear about that.
No, it's fine. It's fine. It's I just hope that someone watching the podcast would find it helpful to either their friend, their sister, their own child, or themselves. They are going to the hospital, to always speak up. We have the right. I don't know. Talking about rights, coming from Africa, we don't really exercise our rights as much. And that's another thing that holds us back in this country. We don't remember that we have got rights and we can exercise them. And it's about, learning when to exercise those rights, when to speak up, how to speak up, who to speak up to.
Exactly.
Because it's hard. Like you're saying, I could have just, go like, okay, they said I should go home. Let me just stay here. And that would have happened at home. And what was I going to do then? What was I going to do then? Me and my husband, we were all very young. We were in our early 30s. I think I was 30 actually. And 30 in an African culture, we're very young. If you were brought up here and you're 30, it's different. You're grown up. But coming from Africa, 30, you're still young, because we are still treated young until possibly now, when in my own family, they still consider me as, the young one. But it's one of those things that I don't know if that was going to happen at home with my husband, very naive, both of us. We were just going to be probably say no more children. If that was going to happen at home, because even after that, he saw the baby, after they had wrapped it and put it in a little basket and gave it to us to see and all that. He was like, no, 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 I don't want to touch you. I don't want to do anything. We don't want, we're not ready for babies. And it took a miracle for me to actually have the baby, my first son, because he was like, no, he was so traumatized. And I just imagine that if that was to happen at home, like the baby came out at home that tiny, how then was he going to react? Because what happened after, when it came out, was even more traumatic, because the placenta couldn't
That
come
was
out.
traumatizing.
The placenta couldn't come out. So they
How come
tried.
they didn't even advise you that this is what you're to expect? Do you know how horrifying that is?
I'm telling you, that's what I'm saying. That's what they should have said to me. Like, okay, we've lost your water. We'll get you. You can wait at home. Or maybe because of beds. It could be the reason for beds. Maybe they didn't want to put me in a bed to wait for that to happen. However, they could have explained to me that maybe when you start to feel contractions, come back. And then we'll, at least I would, although I'll be devastated that I'm losing the baby, but I would have prepared my mind of what to come. When the baby came out, then it was like, yeah, we're going to wait for the placenta now to come out. Okay. All right. Not waiting. Okay. It's not coming. Someone was monitoring me quite frequently. But if you feel anything, just let us know. Like, if you feel a lot of blood coming out, just tell us. It started coming out. I had to be rushed to theater to get the placenta out. And my husband was there. He saw the whole gushing of blood. It was like so traumatizing. And went there, they managed to get the placenta out. Luckily, they didn't have to give me extra blood, but I lost quite a lot of blood. But, all of that, there was no preparation of that. It was to come, and if it was all last minute. Oh, it's coming on now. Please consent. If we need to give you blood, consent, sign here. Like, rushed. Like, really? Have you not experienced this before? Is this not something that that you should prepare the patient? And again, this is where I feel like if there was an elderly person there with me, either my mom, my sister, or an aunt, maybe they would have said, okay, now that the baby has come, this is what will happen, the placenta, it might not come out, and you might need, all those kind of things. I think that could have helped in terms of the community part. But as for the healthcare service, they should have done better themselves, I feel. They should have done really, really better. And I think that's why maybe they were like, okay, here's the form, please. You can sue us, sue the NHS, But then at that time, I was very much a very spiritual person. And my pastor, advised me against it, to say, if you go down this route, your journey from now on would be getting something back from the NHS, rather than focusing on you having another child, because you don't know how long this, legal process will take. It might take years, and your mentality would be getting, the NHS to answer, but then it's going to take you a while. You don't know how long that will be, and you need healing. You need to heal. So that's what happened. I know you're shaking your head because I felt that I should have really sued them regardless. I could have done both. I could have done both. I could have moved on, but be suing them no matter how long it takes, and still be having the babies that I wanted to be having. But it's one of those things. I did have support, but although in a different way.
I'm shaking my head because there comes again the aspect of religion, where we are expected to listen to spiritual people we call spiritual leaders, and against our own choices as women. what we're feeling, him telling you from what basis,
Yeah.
people digress from what the word of God is saying and, begin to dabble into legal matters that they know nothing about.
Yeah.
And there you go, you've lost out on both sides. These people were not held accountable, and you're
No.
listening to those people again. So it's on every angle, when we come to our culture, Black women, we are listening to spiritual authority. Okay, we are also meant to submit to men in authority. We are sometimes not expected to speak up in our society and to lead in our community because we are women. So on all angles, we are faced. And this is the reason why sometimes we keep quiet. And a lot of time when we try to speak, we are also labeled as the, strong women, aggressive women. Okay, we are perceived as resilient, strong, unbreakable. But in reality, I would like to say this in this podcast, Black women are also very vulnerable. We may sound very confident the way we speak, but we are very, very much vulnerable. And people must look at us through the lens of that vulnerability to understand our symptoms. Somebody right before you saying, these are my symptoms. You have to look at those symptoms and help us accordingly, because we might not look like what we are feeling, because that is how we were brought up, to be strong.
Yes. And it's not just about strong. What I've noticed is as well, sometimes when we are angry against our white counterpart, they get red. If they're in pain, they get red. We don't get red. You can't see any skin changes. So I think that's another thing, because we just look the same way, whether we're in pain, unless we're screaming or crying. Our skin color doesn't change to signify, because like sometimes I say, you can see they've got red cheeks or whatever. We really, you can't see any red cheeks, especially if your pigmentation is dark on the darker side, like myself. You can't really see. So I feel like, things like that as well, because maybe if I was screaming, because I wasn't screaming, I could see there were other women waiting. There were other people that were more, I would say they were looking more in pain than me, but I did not scream. I just walked, I just paced up and down. I'm praying. I'm like, God, please, what is this? I need this pain to go away. And I would go there and I would ask gently, like, please, please. Again, that fear, that respect that we have with us, back home. Because back home, there's a myth that, not a myth. There's this thing that nurses would actually are the ones that shouts at the patients, right?
Yeah.
So I'm having that in mind, like, I don't want them shouting at me, and so I'm not going to shout. So I'm going to be nice, and so that they're nice to me. And I'm trying to be as nice as I can be. And it makes me think, like you're saying, was I supposed to be a little bit more aggressive about it? Was I supposed to say, I need a doctor now, please, can I see a doctor now? Was I supposed to be like that? But I was gentle. I was like, please, I'm in pain. I'm having contractions. I didn't even know what they were. I'm like, I'm having this constant pain coming. I was not even, and then somebody said, are you having contractions? I'm like, I think that's what it is. Yes. Can you imagine? I was so naive. I had no idea what was going on at that time. So it's really sad.
Yeah.
It's really sad.
It's interesting that you say that, because a lot of times in our community, there's emotional suppression, and there's the postnatal depression stigma, even after you have your baby, and there's this mental health stigma. I remember once I was speaking to someone, and we're talking about mental health, and she just laughed. She said, do we suffer mental health as Black women? And she was laughing, because there's a stigma around it. When we go to our community and say, I'm having mental, they're like, what are you talking about? There's a stigma. We are expected to be strong. There's even people going through immigration issues is layered on top of that. So, and it could put a pressure. All of these things put a pressure on us to be strong. So did you feel at any point that you were pressurized that I must feel strong,
Oh, yes. And this came from both sides, from the family and from the hospital. Like I said, I did not really get that much care I saw care afterwards. So what I saw afterwards showed me that actually, what was that about when I lost my baby? There was so much expectation of me to be strong, like being left in the room alone, waiting for my husband who had not arrived. Why was there no one there to stay with me? Yeah, why was there no one there to like to, when they just leave me with a sick boy and say, yeah, when you feel like this, take this to the toilet. And like no, they should have been that day. I feel like that they expected me to just handle it. Like, yeah, she's been handling it for the past 3 days. She stood outside waiting for 4 hours. What else can happen to her? She's strong, she's not I was not screaming. I was not really. The only tears only started coming as soon as they said, this is it. Yeah. But I knew that's what was happening in the end. I was like, okay, the way I'm feeling, I actually left out some information because I don't want it to be too graphic on this podcast. Before I went to the hospital, I did ask my husband to have a look because I was feeling something down there. And what he saw, he was like, I don't know. But I'm like, I think he saw the baby. But he didn't want to say. And when I went there, and I knew that the baby is there, it's just ready to come out. All I needed was to push, and I could have pushed. But I didn't know. Like I said, we're so naive. And that was it, that expectation, like, just be strong. Be strong. I need to just be strong. What else can happen now? It's like, I think I've lost the baby. The waters have come, and I'm feeling contractions. What else is there? Could you just wait like everyone else. Like, nobody's really trying to assess me, like, what exactly is going on. Regardless the amount of time I went to that desk to say, please, can I see please, can someone see me? Please, please, please. Without tears, without shouting, without being aggressive. I felt, or without my skin showing any redness or show that I'm in distress. That all to me gave that impression, maybe a strong woman, a strong black woman. But I don't think I was that strong in that moment. I was so scared. I was very, very scared. Looking forward to having a baby after so many years, and you're like, yes, we want to have the baby. And then I'm scared. I'm like, I think I'm losing the baby. No one has said it yet. It was just a confirmation that needed to be told. But, that expectation, like, I felt like everybody was just like, not really giving the care, just like, yeah, you're strong, just wait.
Yeah.
We'll see you,
Yeah.
Yeah.
So you talked about you being given the 5-star treatment afterwards, but did you feel like emotionally you were supported, by the system, by any group of networks and people like that through this process? Did you have that support?
With my second pregnancy, as I say, I was cared for by the key consultant at UHCW, which is the University Hospital of Coventry, Warwickshire. And he was seeing me pretty much. If he could get away every week, he wanted to see me every week. But it was becoming too much. So I was being seen pretty much every other week. So 2 weeks, every 2 weeks. And when I've gone in, there was so much services that I received that I didn't receive in my first pregnancy in the same period of time. And I did not receive all that much as well in my third pregnancy. Although my third pregnancy was also with another research unit, so it was almost like a study. I was a study for them, but with the second one, there was quite a lot support, even with the midwife. I'd never got a call from the midwife with my first pregnancy, but my second one, I did get a call. So I don't know whether there was communication from my consultant to say you will need to be checking this patient. So although I had the regular appointments that with my midwife, she was calling me randomly, like just checking, are you okay? How are things? Would you like me to see you? Like, I know we're seeing, let's say she'll call me on a Monday. She'll say, I know I'm seeing you on Wednesday. Would you like to come down? Like, no. Why should I come? That kind of thing, which I felt it was extraordinary. But I know why. Obviously, with what I've told you, we know why that happened. Afterwards, there was communities that I was going to, in the local community there was a local, it wasn't a library, it was like just a center where there would be someone from the health. But it would just be like playtime, but there would be discussions. And this, we started going there before the pregnancy. So you have the outside the sessions, so you could go with your partner, you learn a few things. But I wasn't aware of this place with my first pregnancy, the whole 20 weeks. I didn't know there was somewhere I could be going. I only found out with my second pregnancy. So I don't know whether some of these things I would have known if I didn't go through the trauma. Probably I would have had my two pregnancies, have my babies, and know of what's available. I don't know. I'm not sure. But yeah, I did have quite a lot of community support. And actually, I was off sick for the first 6 months of the pregnancy. As soon as I found out I was pregnant, I worked up to 3 months, and then that's it. Actually, maybe 2.5 months. And the doctor said, no, I don't want you to go to work. I said, but I'm feeling fine. He said, no, stay at home. So I literally just stayed at home. And unfortunately, around the same time, around 20 weeks, the same thing that happened with my first baby started to happen. So my cervix started opening. But they only noticed because of what? They were monitoring me more than they normally did.
Yeah.
I feel like with my first pregnancy, after the first 20-week scan, if they had done it properly, they could have seen that my cervix was opening. So what they found out is that I cannot hold boys. So yeah, my cervix can't hold boys. So with my second baby, at 20 weeks after scan, they said, okay, we've scanned, but we need another scan. I'm like, okay, why? Mr. Key want to see you again. So Mr. Key assessed me and then said, no, I need you to go for the scan again. So I went again, and they said, okay, when was the last time you had some food? I'm like, I think around 8 before coming here. And this was like maybe around 1. They said, okay, don't eat anything, don't drink anything. We're going to go to theater. I'm like, why? Then we're going to put a stitch, a suture to stop your cervix from opening. Because if we let it out, if we leave it, you're going to lose the baby. I said, okay. So now I call my husband and I call someone else. I said, okay, and I'm here. They're going to keep me. Please bring me a BCD. And then I stay in, and they were like, okay, sorry, we've had an emergency. We can't do it now. We'll do it later. And then they kept having emergencies throughout, and I didn't have the stitch until the next morning. But at least I stayed in, and they monitored, and they saw what was going to happen. And then they put a stitch to stop the cervix from opening. And then after that stitch, it was, now I'm sorry, but you can't go to work. I was already off work, but it was like now I was going to say maybe you can go, but now I need you at least 2 months to be at home. So that was now, luckily I was working for an organization that has sick pay, so I had full pay for the whole time I was on bed rest, literally bed rest. He said, I do not even want you to even mop the house, please don't even mop. Just bed rest, just because your cervix can't handle boys. I said, okay, that's fine. So yeah, that's what happened with that one. So after, when the baby was due, then they took the stitch out. That was a very simple procedure, I think, because I didn't need to go to the theater to get the stitch removed. And I thought that the minute they take the stitch out, the baby's just gonna go like out. But no, it didn't happen like that. It was it took another couple of days actually. They induced me, because they had to induce, because obviously after the stitch is put, it's almost like bind the cervix even harder. So they had to induce me, and it took another 2 days before the baby actually came. And I had never seen the amount of people that were in my care during pregnancy. I mean, I'm comparing the first and the second and the third
You look
one.
like in a different country.
Yeah,
Different institution.
I had 12 people.
Wow.
12. Yeah. So
Yeah.
12 people came and they were all under my care with my previous self. It was crazy. I'm like, are you sure you guys are all here for me? You know, they were like, yeah, this is this, such and such. Everybody had advice. Everybody had advice. And to make sure that if one is on break, someone is
Someone
available.
is there. Yeah.
And I had 3 midwives, one main one and 2 others just to support. I'm like, okay. Yeah, this is what I'm saying. I had 5-star because it was like extra to me,
Extra,
a little bit too extra. Although I couldn't have the birth that I wanted, you know, like you want to have
Yeah.
a water bath, and all that kind of stuff. I couldn't have all those luxuries because it was like, yeah, you're not vulnerable, you're risk pregnancy. My blood pressure was fine, so luckily for me, my blood pressure with my first and second baby was fine, and you know, baby was delivered safely, without the need to go to theater, because that was what they were scared that might happen because of the stitch as well. But yeah, so yeah, it came, and yeah, I actually went to home soon after the baby was born. Not long. I think they kept me for another maybe 5 hours, and they were like, yeah, you can go. So yeah, I had visitors come in, the health visitors come in. I feel like they came pretty more often than they did with my third baby.
Yeah.
You know, like you kind of think, shouldn't there be someone today? Like no, like, oh yeah. And then I asked them, I'm like, oh no, we only come. I'm like, seems a little bit different, because the second one I had quite so many visits, you know, in the first week. So many visits to just monitor the baby. But yeah, it shouldn't be like that. It shouldn't take trauma. It shouldn't take a loss. It shouldn't take
But for you to arrive
to
at that,
actually get.
Now, many Black women in the UK now feel like they must research everything, rightfully so, question everything, advocate strongly just to stay safe, because of all of those misconceptions, fear of being misunderstood.
Yeah.
I know the microaggression.
Yeah.
A lot of times there's also racism in the system. You know that people now feel like we must challenge the system. So I hope healthcare providers are listening and watching, and to understand that we fear being misunderstood. Okay.
Yeah.
We detest microaggressions towards us. We have a culture of respect, and we may not speak up most times, but we are also encouraging women to speak up and ask for clarity, ask questions, do your research, bring someone for your appointment, know your rights, because I think that's where we are lacking a lot. A lot of us do not know our rights. And we need to build community intentionally so that, if there's a symptom, like you have experienced this, Joe, and somebody else also in your community experiencing, you can say, no, this has happened to me. Please, can you, be outspoken? Can you say no? Because when we come collectively as community to act as one, we are more powerful, I would say. So finally, Joe, what will you say to your Malawian community, or every black woman currently listening to us in the UK and all over the world as well? What's your final advice for them?
So speak up early. Ask for clarity. If you can't understand anything, you don't understand what they're saying, or you kind of understand, but you don't know why it's there. You know, sometimes you might say, okay, I understand what you're saying, but why should I have this? Or why are you prescribing this to me? You know, always ask questions. Ask, like, can you explain a little bit further? I do not understand what you're trying to say. And they're always willing to help. They're always willing to explain these things. And as you mentioned, bring someone to appointments. You know, sometimes if you're married to an African man, depending on how they grow up. If they grow up in a household where the father was the father who doesn't really do anything else around the house, you're most likely to have that kind of husband, and they might not be the right person to come with you. Okay, so it just accept that you do not want to have what others are having. I know when you go to continental sessions, you see people, a lot of white people, even Asians, not Asians, no, I don't see a lot of Asians. A lot of Asian ladies come with their mummies or aunties, yeah, or their sister, because or culturally their men are not built to do those things. So if you are from Africa like myself, please, it's okay if your husband is not that kind of person that will show support or will just cause a lot of stress. It's okay, leave them aside. As long as they're there during, the delivery and all that, it's fine. Identify someone within your community, whether it's a friend, an aunt within, when we talk of aunties, we're not talking about your aunt from your mom's side or dad's side. We're talking about someone in the community who you identify as an aunt. You can ask them nicely. Look, I'm having a baby. I'm going to have appointments. Will you be able to accompany me? If you can't identify someone like that, a friend, I'm sure most of us have got friends that will be willing to support us. You can tell them in advance, I'm having an appointment on this day. I need you to come with me. I just need someone for moral support. It's very important, very, very important. For me, bringing my husband is just, you want stress? Bring him. I don't really, not that it's a bad thing. It's not a bad thing. It's understanding who we are. Sometimes I've read
the best person in that position to help you.
I've read this book about let them. Sometimes you can't control things that are out of your control. So it's like, okay, you are that person. I accept you the way you are. That's fine. Yeah, that's okay. So don't stress over things that you can't control. And as Vivian said, know your rights. There are certain things that they give us, and I've noticed that a lot of us Africans, we don't like to read. That green book, I don't know what color it is now, but during our pregnancy, we used to have that green book.
Yes.
It has a lot of information. Read it. Me, I was reading some of the information after I gave birth. I was like, oh, I should have done this. Too late. Yeah. So when you're given things, read them. Take your time and read them. Now we've got AI. Find out, what am I expecting? What should I be expecting during pregnancy? What are my rights for my pregnancy? Absolutely. Understand those things before you go to your appointment. Whether it's your appointment with the midwife, whether it's the appointment at the hospital for scanning and all those things. When they're scanning, sometimes you are looking, they're showing you can't see what they mean. Tell them, look, I don't know what you're showing.
Understand? Yes, true.
Yeah? Tell me, I don't know what you're saying. Please, what is it? Where is the baby? For me, it took me time to see. I was seeing things, but I could not see the baby. I'm like, what is it? Where's the head? So let them point. Let them point it where the head is, where everything is. So don't just say, oh, yeah. And then you walk out thinking, oh, but I didn't understand. What's the point? Ask right there and then. Some of them, it's their passion to do that job, and when you ask those questions, they find pride in explaining those things. So don't feel like, oh, I don't want to look stupid. Look stupid. Be stupid in that moment. Ask stupid questions, and they look stupid to you, but they're not stupid to them. So ask them questions and understand. And as I say, in our community, I know some communities don't do this. In our community, when we are having a baby, we have a baby shower. Our baby shower is not just for baby reveal nonsense that people are doing these days, where it's just baby reveal. Oh, it's a girl, it's a boy. No, they're more structured. They're structured in a way that we are helping women understand certain things. Unfortunately, most of the baby showers are happening at 7 months. We don't want to do them early because, as we're expecting pregnancy, you don't know what's going to happen. So we tend to do them towards the end of the pregnancy, which sometimes is not very helpful, but it is helpful for the after, when the baby comes. So we tend to give advice that should help the mother and the father to be. Things that they should expect, even these things that we're talking about here, we tell them there. at the baby shower. We tell them, speak up. If you're in pain, tell them you're in pain. If you're feeling somehow, tell them you're feeling somehow. Tell them, yes, maybe I didn't want epidural, but I'm sorry, can I change my mind? Can I have the epidural now? You're okay, you're ready, unless you have gone past the time to have it. But if you are still within the period of time, you can change your mind, although you already had your plan, because they will tell you to have a plan, isn't it? Your birth plan.
Your
You
birth
can
plan.
change that anytime. That is not a set thing. You can change your plan, just like they change. They can tell you, oh, things are not working, we're going to take you to theater. It's the same thing. If they're going to change their mind, take you to theater, you can also change your mind and say, look, I need that pain killer that I said I don't want. I need it now. And I need to make sure I'm feeling too much pain or whatever it is. Yeah, I think to me that's what I can say in terms of maybe building community intentionally. If you don't have this kind of thing in your community where you do baby showers, but do build intentionally your community, as I say, get someone that you can trust, a friend, a very close friend, and someone who you identify as an aunt. At least 2 or 3 people that you can say, I can have these 3 people. If one of them is not available, you've got that other one. If the other one is not, at least 3, surely one of them should be available, especially maybe the day that you're going to give birth. If your husband can't accompany you or can't be in the room for cultural reasons or for whatever reasons that you do not want them in there. So yeah, make sure you do these things and your pregnancy should be fine. Thank you.
This is really so insightful, Joe. So much wealth of knowledge from you there. So much experience. Just thank you so much for sharing. Thank you so much. I appreciate you for coming.
Thank you for inviting me. Thank you for inviting me. The minute you posted about this, I was like, yes, finally something that I can talk about and share. And I'm hoping I will share once you release the video. Please let me know. I'll share it on my TikTok page.
Yes, that's
I'm building my followers. I'm at 1,995, but it's still a lot of people to reach. 1,000 people is still a lot of people to reach. So I can share it on my social media handles as well, so that women and fathers can learn and understand what are our rights, what it is that we need to be doing in this country, things that we're not aware of. They say, yeah. Thank you for having me.
Thank you very much. And bye-bye, everyone. Make sure you tune in and watch. Thank you. And share, like, subscribe to this podcast. Thank you, Joe. Thank you, everyone.
Thank you.